To treat outpatients or to treat patients in an outpatient setting is becoming more and more popular. That is the reason why I'm talking today about the management of the CMC1 arthritis with prosthesis in an outpatient setting. I'm in the position to have 3 clinics when we do just nothing else to treat outpatient settings. So, which prosthesis do I use? Since now about 10 years, I'm using the Touch from Medartis. Is this, from my point of view, currently the gold standard? Yes. Are there any indications, from my point of view, to treat patients with the prosthesis in an inpatient setting? Very, very few. How many prostheses do I implant per year in an outpatient setting? It's currently about 300 a year. The next question is, how many prostheses do I implant per year in an inpatient setting? Approximately 0. Since when do I implant the prosthesis in an outpatient setting? Is now since 2020. Before, I did everything in an inpatient setting, now everything in an outpatient setting. What are the indications for the prosthesis? Very simple, CMC1 arthrosis, after all conservative measures have been exhausted. And the contraindications for me, the painful and advanced ST2 arthrosis, infections, and the destroyed trapezium. Diagnostic before my surgery, so we have this CT scan in the praxis, and what we do is a CT before the surgery, just to be sure that everything is good. How long does the surgery take? It's about 20 minutes. And how long is the patient in the OR? It's about 30 minutes. So management is everything. I will show you something. How long is the stay in my practice? Yeah, that is prescribed legally about 2 hours. The aftercare is 2 weeks splint and then slowly increasing the load. Return to work is after 4 to 6 weeks. And then what about sport? So I prepared this talk 2 weeks ago, and 1 week ago I phoned 3 patients just without anything to send me videos why they are doing sports. And now you will see that German people are sometimes really, really very scary. So I called this patient to send me a video how he's doing sports. So I don't know, really, I don't know what he's doing there, but I just show you this video. But he also showed me other videos. The left one, I don't understand why he's walking down the stairs like this. Yeah. The next one sent me this video last week. And the third one sent me this video last week. All got some years, some months ago, a prosthesis. What are the complications? I swear you, that is no lie. No infection, no luxation, no loosening, but you have to know the pitfalls, yeah? The patient's feedback is very, very good. Now, my question was management. What does outpatient management mean? Probably the next video will disturb you a little bit. My daughter did this video, and that was last Monday, and I asked the patient, I phoned the patient on Sunday if my daughter can make a little video. So just look. This is a normal patient, and this is the third one on Monday morning. It's 9:45. The patient is coming. 9:48, 9:49, 9:51, 9:55, I'm always there because it's not necessary to go out. There's no time. 9:48, 9:49, at 9:59, 10:03, 10:03. Chef preparation, cup preparation, implant shaft, implant the cup, test neck, final neck, small one, 50 degree, 15 degree. Suture. Final X-ray. We are finished. The next one can come. The patient is going then some minutes later in the first OR, waking up, and then every patient is getting a coffee and then leaving the clinic after 2 hours, 2:30. So the diagnostic after the surgery, we do again in all patients a CT scan. It's the low-dose CT scan, just to be sure that everything is okay. So take home, management is everything, everything. The dual mobility provides a good function in terms of range of motion and early recovery to work and to power the hand. It's a safe procedure if you know the pitfalls. We have a very steep learning curve. A lot of people are coming to, but now I'm working and they look what we are doing. There's a very high patient satisfaction to go home and sleep in their own bed to look TV. The 10-year survival rate of this prosthesis is more than 90%. In case of complications, it's possible to do a trapeziectomy with or without a suspension. That's all. Thank you very much.